Hello, I'm Monica Cavazos, registered nurse and Chief Clinical Services Officer for Peoples. Many of you are familiar with how the clinic works during normal times. Today, I'm going to share with you how the clinic has responded to the pandemic and how we've made changes in our service lines to continue delivering care while keeping our patients and staff safe. The past year and a half have been incredibly challenging for Peoples and our patients, as I know these times have been difficult for all of us. Peoples began drafting preparations for COVID in January of 2020, but when COVID actually hit in March, there really was no playbook for exactly what to do. The clinic had to quickly change our ways of seeing and serving patients in a short period of time to reduce risks. We were also short on protective gear and had to rely on our relationships with donors and the community, who donated thousands of masks to us. One of our physicians even made face shields for clinical staff during the worst of the pandemic. Even during the worst of times, our goal to serve our patients remained unwavering. The clinic, from its founding, has been dedicated to treating patients with dignity and respect. It's part of our DNA, and we've stayed true to that. Our response to the pandemic was to ensure that those who are most likely to fall through the cracks don't, and that is written into our mission statement: to improve the health of the medically underserved and uninsured. The clinic has remained in full operation during the entire pandemic. Many of our usual workflows had to be changed, and we added a safe way to treat patients with COVID symptoms, to do COVID testing, and to provide COVID vaccinations. There are key goals that served as a foundation to our response to this pandemic: to be safe, to be efficient, and to make it easy for our patients to access care. We started early on with drive-through testing for COVID to reduce risks for patients and staff, and later added strep and flu testing. At our Center for Women's Health, we instituted drive-through birth control injections. And this fall, like last fall, we're providing drive-through flu vaccines. A very generous friend donated the big tents outside the clinic. The clinic pivoted to telemedicine within days of the first lockdown in order to reach patients where they were and to limit exposure to COVID. Peoples now offers telemedicine visits across all medical departments, as well as remote behavioral health and health education visits. In adult medicine, at the height of the pandemic, telemedicine helped patients who had transportation challenges and decreased our no-show rates. However, as you know, the pandemic has exposed many inequities, and just having access to enough broadband for video-based visits is one of those. Many of our telemed visits are conducted over a telephone, which has become a healthcare lifeline to those with limited or no internet service. Drive-up services complement what we do inside the clinic, where there are dedicated areas for any patients presenting with COVID symptoms. Droplet clinics are separated from other areas and follow a careful protocol for safety. To stay in touch with patients and to be helpful to the general community, Peoples began a regular live broadcast by our physicians, nurses, health educators, and even our legal director, who discussed health and other related issues affected by the pandemic. These broadcasts were in both English and Spanish on Facebook, where we have a large audience. We covered everything from children and COVID to the vaccine to legal issues facing immigrants. The clinic also extended its early childhood development program online, introducing families to children's books and creative instructional videos of art projects for kids. Shifting gears to where we are now, over a year and a half into the pandemic, thankfully, we're vaccinating our patients and the community against COVID-19. When vaccine supplies were short, People's priority was outreach to elderly and patients with chronic disease. Now, our vaccine clinics are open to all who want a vaccine, and anyone can schedule a vaccine online or on the phone. One challenge we've encountered is vaccine hesitancy. Patients come to us with many questions, and there's sometimes a lack of confidence in the science. But because our model of care here at Peoples is built on developing relationships with our patients, we are well positioned to be a trusted resource to respond to patients and help them make an informed choice about vaccination. During the early days of the pandemic, we shifted gears quickly. Because of you, our friends, we were able to make those changes. Without you, our model of high-quality care with dignity and respect would not be possible. Thank you.